sure it's a milia or a blackhead. It could even be a scar. Like you might just kind of pick at this one and it gets a little firm like that. But we'll know if we put a little numbing. So I can feel a little firmness there. I'm gonna put a little baby pinch here under your skin pinch. You okay? Good, right? Okay. Oh, you don't say anything. Okay. She's cute. If you say anything and because you need to say something, please tell me, and I will definitely mute that out. Okay. You don't have to say anything now. So I put a little numbing there just to make sure it's not uncomfortable, and I'm gonna put a little nick in the skin because I can feel something under there. I kind of go in the direction of how our skin lines are, and let's see if it'll do anything. For you, go straight on, a little bit straight on. I think sometimes it's a little, I'll turn her, a little angle there. A little pressure. Ah, you're right, it was a milia. See, it's right under there. A little pearl under the skin. I'm gonna actually show you if you want to see. You can open your eyes and see.
Oh, there we go.
Yeah.
Love seeing that.
Don't you? Does it make you feel good? If you want, you can keep it. So that one's done. It was just a little bit, and that's fine. It'll go away. Okay, I'm gonna put a little numbing on the one above your eyelid here. Turn this way a little bit. Good. Close your eyes. Okay, this is numbing. Same thing. A little baby pinch here, pinch. The skin's sorry. I know. A little pinch. And now for the other one, I am going to numb it too. Okay, but I want you to open your eye and look up. Okay. This is just numbing fluid. If it goes into your eye, which I doubt it will, but if it does, it just numbs. It doesn't make you unable to see, okay? Just gonna pull your eyeball all up. See, there's one right on the edge of our eyelid here. Baby, pinch here, pinch, pinch. There we go. Close your eyes for a minute. Good. Just trying to push the fluid away from your eye so that it won't cause an issue. You keep your eyes closed now, because I'm gonna put a little nick in this one. Are wily. I can feel it move around underneath my little blade there. Let's use a small edge here and push against your eye here. There we go. Okay, there's another little one. You want to see that one? Oh, a little cute one, huh?
Yeah.
So you're like, whatever, that's stupid.
No, it's like I don't know, satisfaction.
Yes, that's why you're gonna like watching these. You're gonna see, you're gonna like watching these. So the next one is numb, but I know got you tearing a little bit. Open your eyes. I'm gonna use a buzzer here, okay? Let me grab a fresh piece of gauze. Just to clean your eyes. So close your eyes for a minute. I'm just gonna rub it so that you don't have any tears right there. Okay, so turn a little bit this way. Now she has one on the edge that I put a little numbing. You're gonna hear this noise. I'm not gonna treat it yet. I just want to see where it is. See, it's right there. So you're gonna hear a little buzzing. You okay? Okay, I'm gonna do one more time now. See, it's right there. Oh, you okay? Good, good, good. Okay. Shh, you okay? You open your eyes again. I'm not gonna do it again. I think we got it. Just wanna feel around for it. It's like a come straight on for you, okay? Valerie, I think sometimes when we get at an angle, we can't see the whole thing, but I think we got it right there. It'll kind of extrude. It's what we do here with that one is we use a little desiccator, so it kind of dries it up right there. That's it.
Love it.